On this Tuesday night, troublesome new trends. COVID-19 is spreading through communities at an alarming rate in Canada's largest city. Who is most at risk?
More public health measures are needed.
Plus, new concerns about COVID-19 in Alberta's capital. The uncertain future of Newfoundland and Labrador's only oil refinery.
The call there is, what am I going to do?
Fresh criticism of the American president, his misleading tweet as the virus spreads to the Pentagon. And a somber goodbye to the golden boy of Canadian politics.
We need more people like John.
The state funeral for former Prime Minister John Turner.
Global National with Donna Friesen.
Good evening and thanks for joining us. After all the warnings about a second wave of COVID-19 this fall, some regions in Canada are not prepared for it. There are not enough tests, not enough labs, and not enough contact tracers. And the virus is spreading through some communities at an alarming rate. Quebec had a record high number of new COVID-19 cases today. The health minister there says it's too many to trace and they don't know where people are getting infected. In Toronto, there are reports more than 10% of tests in some neighbourhoods are coming back positive. That means uncontrolled community spread. Abigail Bimman has our top story tonight.
Federal health officials say if a community's positive test rate is higher than 5%, it's a problem. There's new data showing in some pockets of Toronto, the rate tops 10%.
That's where we have to focus on. We go out there, we put the mobile testing units up, we get more advertising within those communities.
That is very concerning. Those rates are high, and those are neighborhoods and areas that we already knew were at increased risk based on other data.
Increased risk with a high number of racialized and low-income residents.
It's very alarming because, of course, the report is around specific neighborhoods in Toronto, but we know that people don't just stay in their neighborhood. And it is an indication that more public health measures are needed.
While Toronto's top doctor has been calling for tougher measures, the Premier isn't budging on closing restaurants.
You can't put people out of work. Tens of thousands of people destroy their lives, just like bang, that quickly.
Meanwhile, Doug Ford says they're making progress on the testing backlog, reducing it by 40%. As of Tuesday, all centres moved to appointment only, but trying to book a test in Toronto is a challenge, with each hospital on a different booking system and many full.
We are adding to the lineup of rapid tests that we have procured.
Health Canada has now approved the first antigen test, the Abbott PanBio. The government is buying up to $20.5 million.
This type of technology is not as good as the PCR-based test, but it doesn't mean it doesn't have certain advantages.
Abbott's own website says the PanBio provides preliminary results and can't be used as the only basis for treatment. But its advantages include being faster and easier to use. It's the test Ford keeps calling a game changer. Ottawa says it's valuable in isolated areas, and its strategy around rapid testing means using them to supplement, not replace, traditional ones. Abigail Bimman, Global News, Ottawa.
The federal government says more than 8 million of those rapid tests will be distributed across Canada by the end of this year. Here is where we are at today. Quebec reported more than 1,300 new COVID-19 cases. That is the most in a single day. In Ontario, more than 540 people tested positive. Alberta recorded 276 new cases today, and BC just over 100. Alberta's chief medical officer is sounding the alarm, warning tighter public restrictions could be imposed because community transmission is getting out of control. In Edmonton, many people are ignoring the rules and not self-isolating while they wait for test results. And as Heather Yourex-West reports, active cases in Alberta are now the highest they've been in nearly 5 months.
At 50% capacity with no weddings or large events, it's been a summer of treading water for this Edmonton restaurant. But its owner says they've managed to adapt so far.
To be able to do that and then now have to consider going back to where we were and having to pivot again and find another way to keep going through takeout and delivery and those sort of things, it's scary.
For the first time this fall, Alberta's chief medical health officer is warning new restrictions may be coming in Edmonton. Since the beginning of September, Alberta has managed to keep its curve relatively flat, but a surge over the weekend is raising concern over what's to come.
We have seen an escalation of cases in Edmonton, an increase in the reproductive number to 1.3 last week, and a rise in active cases.
What's behind the spike is under investigation, but health officials say it's clear that not everyone is following guidelines.
One alarming trend we have seen in our review of current active cases is about 11% of cases are attending work or still going to social gatherings when symptomatic while awaiting test results.
Part of the problem, a backlog at Alberta labs, means it's taking up to 5 days at times to turn COVID-19 test results around. Cases are expected to increase in the coming days, but the real test will likely come after the Thanksgiving weekend.
If we have a high case number in the community, the risk of having spreader events at these social gatherings goes up dramatically.
Not good news for business owners hoping to avoid another shutdown as Alberta inches closer to its second wave. Heather Yourex-West, Global News, Calgary.
British Columbia is in a better position. The provincial public health officer says the COVID curve there is flattening, and for the first time since the summer, the transmission rate is manageable. But as Robin Gill explains, now is not the time to widen your social circle.
One of the worst outbreaks in British Columbia is on the second floor of Delta Hospital in a suburb of Vancouver. 18 patients and 17 staff members have tested positive. Some of those healthcare workers brought COVID into the hospital.
Any healthcare worker who is in the community risks picking up the infection and bringing it to work where, of course, their patients are impacted.
If there's some consolation, for every person infected with COVID-19 in BC, they've passed it on to less than one person. So there's no exponential exposure. According to the province's public health officer, that's a key factor right now.
We're keeping our curve flat and low compared to many other places, but we are not out of the woods.
Compared to other provinces, BC has a tighter rein on the virus. Take a look. Between September 21st and October 4th, BC's total cases were just under 1,500. Compare that to Ontario, which had over 7,500 cases in that 2-week period. But Quebec's numbers spiked to over 10,000 cases in the same time frame.
We've done the right things, and people in BC have taken the measures that we need.
Those measures include shutting down nightclubs and banquet halls in early September to prevent large gatherings. Most people in BC are keeping their bubbles to about 45% of their social network.
People have made tremendous sacrifices in terms of their work, in terms of their education, in terms of their social activities, and that's what it's going to take to continue keeping this thing under control.
These are universal sacrifices because people are still dying from COVID-19. 7 people with this horrific disease spent their last moments at Delta Hospital. Robin Gill, Global News, Vancouver.
Quebec's Premier apologized to the family of Joyce Echequan today. She is the Indigenous woman who recorded hospital staff taunting her and making degrading comments as she pleaded for help. She died soon after.
Madame Joyce Echequan.
Quebec's National Assembly held a moment of silence today for the 37-year-old. She died September 28th at the hospital in Joliette. The way she was treated led to widespread calls for action against systemic racism. Her family is suing the hospital. Today, Premier Legault said Quebec's public service failed in its duty, and he promised change to avoid others being mistreated the way she was. The future of Newfoundland's only oil refinery hangs in the balance tonight. The 50-year-old facility in Come By Chance was going to be sold to Irving Oil, but that deal has fallen through. The Newfoundland government and hundreds of workers had hoped it would give new life to the old refinery. There's talk another company is interested, but as Ross Lord reports, nothing seems certain in the industry right now.
Fortune smiled on workers at Newfoundland's Come By Chance oil refinery when they won a lottery jackpot worth $60 million.
31 millionaires from Newfoundland and Labrador.
2 years later, the refinery's 500 workers fear their luck might have run out.
They're crying and they're upset, and some people are saying, is there hope?
Already reeling from production being halted since April, they're facing the prospect of the refinery being closed permanently. Talks between the owner, North Atlantic, and a buyer, Irving Oil, have collapsed.
The calls there is, what am I going to do? Where am I going to get a job? There's no work out there. The next thing is, what about my benefits? Like, I need health benefits for my kids. I need for my wife, or I need it for my husband.
Of course, the pandemic's impact on oil and gas goes beyond Newfoundland and Labrador. In Alberta, Suncor just announced plans to lay off up to 2,000 people. In the House of Commons, the opposition leader pressed the government about job losses in both provinces.
That's 2,500 working families that are wondering how they're going to pay for groceries. Mr. Speaker, when is this government going to have a real plan for energy workers and their families?
During this pandemic, over 1 million Albertans have received the CERB. Out of a population of 4.3 million, that is nearly 1/4 of Albertans.
The government says it's provided $320 million for the energy industry in Newfoundland and Labrador. That province's Liberal government says it's not giving up on Come By Chance, although negotiations are between private companies. In a statement, North Atlantic says it will not be providing comment on internal, confidential matters. The union says most of its members have been laid off since the spring, and those remaining will be laid off immediately. There is some hope. Another possible buyer from the U.S. has expressed interest, leaving open the possibility that a permanent closure might still be avoided. Ross Lord, Global News.
Canada's biggest oil-producing province, hit hard by a drop in demand, is taking steps to diversify its resource-based economy by becoming an exporter of hydrogen, a clean-burning fuel.
As an energy source, hydrogen produces zero emissions and has greater potential to power not just appliances, but also heavy-duty transportation, heating, and electricity generation.
Alberta Premier Jason Kenney unveiled his province's new natural gas strategy today, which includes ambitions to ramp up the production and export of liquefied natural gas. Finance and investment firms predict the global hydrogen industry could be worth $2.5 trillion U.S. annually by 2050. Kenney also wants to move towards what's called a plastic circular economy, becoming a hub for reducing plastic through new recycling initiatives without reducing production of the material. Michelle Obama, no holds barred, coming up, her blunt message to American voters. The former American First Lady, Michelle Obama, has released a video message called Closing Argument. She makes the case for why American voters should choose Joe Biden over Donald Trump.
The one thing this president is really, really good at is using fear and confusion and spreading lies to win.
Obama was First Lady while Joe Biden was Vice President, and she says he has the heart, the experience, and the character to lead, and that the drama of the past few days has only emphasized what's at stake in this election, from the coronavirus to a constant drumbeat of fear, division, and chaos that's threatening to spiral out of control.
They're stoking fears about Black and brown Americans, lying about how minorities will destroy the suburbs, whipping up violence and intimidation, and they're pinning it all on what's been an overwhelmingly peaceful movement for racial solidarity. What the president is doing is once again patently false. It's morally wrong. And yes, it is racist. But that doesn't mean it won't work.
Michelle Obama also said her heart goes out to all the people who work behind the scenes at the White House, the Secret Service and residence staff, whose names and stories, she says, we'll never know. The virus continues to spread. Today, Stephen Miller, the president's senior policy advisor, tested positive. Also, the top U.S. general, along with other senior military staff at the Pentagon, announced they are in self-isolation. The White House cleaning staff wore hazmat suits to sanitize the press briefing room at the White House. And there's an update on the president's health. According to his doctor, Trump had a restful night and has no symptoms today. As Jackson Prosco reports, Trump seems intent on putting on a show of strength, knowing the election is less than a month away.
Unmoved by his own experience with the virus, an emboldened and likely still infectious President Trump has embraced full-on denialism.
Don't let it dominate you. Don't be afraid of it. You're going to beat it.
In a morning tweet, Trump went further, exaggerating the death toll of the seasonal flu and suggesting we have learned to live with it and should do the same with COVID-19. A sign he plans to portray himself as a strongman against a pandemic that has killed 210,000 Americans.
We have essentially politics infecting our public's health. This is a disaster for public health in general.
It's also now a national security threat. At the Pentagon, 7 senior military leaders, including the chairman of the Joint Chiefs of Staff, are in quarantine after their own exposure. Several of them had been at the White House for this maskless indoor ceremony on September 27th, the day after that now infamous Rose Garden event.
There are more cases coming out of the White House these days than in entire other countries. And that's simply because we're not choosing to fight this pandemic, we're choosing to accommodate it.
Incredibly, the White House, with all its resources, has refused to undertake contact tracing or notification, even as cases now spike in Washington, D.C. The administration is also refusing to give any information about the president's own history of testing.
We need to be taking samples. Those swabs that have diagnosed them as positive have very important information that could tell us exactly how this virus was introduced into the White House, and that genetic information could be used to explain exactly who transmitted it to whom.
The president's defiance of the virus comes as polls show him slipping even further behind Joe Biden. One survey out today has him 16 points behind. At the same time, though, there's still a strategy to try and carry on with the presidential debates. The president says he will travel to the next one, although there's likely to be a squabble over debate preventative measures surrounding COVID-19. Tomorrow's vice presidential debate has already descended into a bit of a squabble over whether or not the candidate should be protected behind plexiglass screens. Donna?
Okay, lots to come. Jackson Prosco in Washington, thanks. Ahead, Devils are back down under for the first time in centuries. Canada is calling for an end to days of deadly fighting between Armenia and Azerbaijan. Canada and the UK issued a joint statement today saying we urge all external parties and friends of both states to redouble their efforts in support of an end to hostilities and to refrain from taking actions that risk exacerbating the crisis. Turkey has been accused of supplying drones and combatants to its ally, Azerbaijan, as it battles Armenian and separatist forces in the disputed breakaway region of Nagorno-Karabakh. Turkey accuses Canada of a double standard. It points to Canada's $14 billion deal to supply light armored vehicles to Saudi Arabia, which has been waging a 5-year war in Yemen. For the first time in 3,000 years, the Tasmanian Devil is back on mainland Australia. Last month, actor Chris Hemsworth helped conservationists release this pair of Tasmanian devils at a sanctuary. 26 of the animals have been reintroduced to an area north of Sydney. Dingoes drove the devils to Tasmania, and then in the 1990s, cancer wiped out about 90% of the population. Only about 25,000 Tasmanian devils are alive in the wild today. Well, 2020 just sucks. Eddie Van Halen, the legendary guitar player and innovator, has died. He was just 65. He had been treated for throat cancer. Through 5 decades and 3 lead singers, he played with all his heart and inspired generations of guitarists. His son said today, every moment with his dad, on stage and off, was a gift. Former Canadian Prime Minister John Turner was honored with a state funeral today, though the pandemic meant it was a modified, low-key affair with a limited number of mourners. Prime Minister Justin Trudeau was there, and he recalled how Turner, who died last week at the age of 91, had said democracy doesn't happen by accident. Eric Sorensen on the tributes to John Turner.
The Canadian flag and an escort of Mounties, an image so befitting a man admired above all else for his love of country. John Turner's funeral brought dignitaries from his days in politics, friends he'd had for life, and family, Jills, to whom he was married for 57 years.
We have lost our Northern Star.
To his daughter Elizabeth, Turner set an example with his dignity. Friends spoke of the great outdoorsman, his generosity, his humor.
When John heard people complain about the weather, he would say, "Come on, are you a tourist or a Canadian?"
Justin Trudeau has known John Turner since he was a child.
Today, more than ever, we need more people like John. His legacy calls on us not to wait for change to happen, but to stand up and build a better country for everyone.
We'll carry our share of the load, and we will.
John Turner seemed destined for leadership. He was charismatic, He'd qualified for the Olympics and was a Rhodes Scholar. As a young lawyer, he had a relationship with Princess Margaret that seemed briefly serious. He turned to politics, recruited by Lester Pearson's Liberals, then served in the cabinet of another rising star, Pierre Trudeau. For Turner, politics was an honorable calling to build a better nation.
I've avoided what I like to call cosmetic politics. The type of politics that look good in the short term but wouldn't be good for the country.
After a dispute with Trudeau over campaign promises, Turner left politics for almost a decade, but then came back for the job he'd always wanted.
Turner, 1,862.
He outdueled Jean Chrétien for the Liberal leadership and in 1984 became Canada's 17th Prime Minister. It lasted 79 days. Patronage appointments left to him by Trudeau led to a defining blow by Brian Mulroney in an election debate.
You had an option, sir. You could have said, I am not going to do it. This is wrong for Canada.
May I congratulate Mr. Mulroney and
the Liberals suffered one of their worst electoral defeats. In the next election, he tried again, debating free trade.
I happen to believe that you've sold us out.
A champion of Canadian sovereignty, Turner would not, however, win back the job of Prime Minister.
Over the years, I've found that the goodbyes in this place are far more generous and spontaneous than the hellos.
Democracy does not happen by accident. Become involved. Get out there. Give something back.
State funerals are rare, but this was unique. In the time of COVID-19, so many more would have wished to be here to honor a man who did indeed give something back.
The funeral of John Turner. That is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is near Maycroft in southwestern Alberta. There are beautiful spots all over this country. Please email us yours to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.